Good evening, Geeta ma'am.
Hello, good evening. How are you?
I'm doing good, ma'am. How are you, ma'am?
Yeah, fine. Absolutely fine. Nice to see you.
Great, ma'am. And then Piyush sir also called sometime back. He is driving now and he'll
Okay.
be joining soon, ma'am.
Yeah. How many participants you are expecting?
Yeah, right now, one participant has joined. Shinjax DT.
Hmm.
That's the name showing in the chat box, ma'am. Let's wait for a few more minutes and then see, ma'am, how many joins.
Hmm.
And then let's wait for their questions, ma'am.
Hmm. Okay.
Yes, ma'am.
So let's wait for 5 minutes.
Sure, ma'am. We'll wait for 5 minutes then, ma'am.
Okay. I'm connected. So
Right,
just
ma'am.
disconnecting
Sure,
my
ma'am. Sure,
video.
ma'am. Yes, ma'am. So, meantime, I will also disable my video and mute myself. So,
Okay.
after 5 minutes, I will resume the session, ma'am.
Okay.
Yeah.
Okay.
Thank you, ma'am. Thank you. Good evening, ma'am. Geeta, ma'am, are you
Yes,
online?
yes, yes. Good evening. I am here.
Yes, ma'am. So, welcome to this live session, ma'am. Right now, two participants are here,
Yes,
Dr. Ambik and Vimala GP.
yeah,
Um, so, you can introduce yourself and then interact with them, ma'am, just in
right.
case if they have any questions.
Yeah, Vimala.
Hello, ma'am. Good evening.
Good evening. Yeah, you are
Yes.
one of the participant of NPTEL
Yes.
course.
Yes, ma'am.
Yeah,
I'm happy to converse with you. Uh, I feel I'm very fortunate.
yes,
Can you hear me, ma'am?
yes. I can. If
Okay.
you can show your video, it will be much
Sure,
better.
ma'am. I don't know how good it's going to come. Yeah, I'm here,
Yeah,
ma'am.
yeah, Vimla, tell me.
Yes, ma'am. Yeah,
Yes,
I'm a homeopath. I'm a homeopathic practitioner,
right,
physician. So
right.
I this news had come in one of our practitioners group. So we thought we'll do this course, and one of my another friend also joined this year. Maybe many have joined the previous years. I don't know.
Hmm.
But as the thing went on, like introduction homeo is given, but I don't know the what will be the scope for this for homeopaths and where we can just involve ourselves in
Okay.
this. I
Yeah,
can.
yeah, yeah.
Yes.
Uh, So we came up with this organization, National Association for Palliative Care for Ayush and Integrative Medicine, with the basic aim is to know the Ayush people know what is palliative care. Many of the Ayush people like you, homeopath, practice palliative care, but you do not know that it is palliative care. That is
Oh,
one thing. So
yes.
any patient, we through this training, through these courses, we have got number of courses, online courses under this NAPCM, our organization,
Okay.
and one of the basic course we have given to NPTEL for the get it popularized in larger group.
Okay.
So the basic aim is to make you understand what is palliative care and how to identify the patient of palliative care and
Hmm.
how to identify needs of patient who needs palliative care. So for this purpose only these courses are there. Now, suppose if you are treating a patient of life limiting illness, what is life limiting illness? It is a illness, chronic illnesses like cancer, HIV/AIDS, end-stage renal disease, liver failure, heart failure, neurological problem, old age. All these patients, if you are treating them with and treating their difficult symptoms, treating their pain, treating their other issues, then it is palliative care, right? So palliative care has got a physical component where you are treating with your medicine or your some procedures like that. But it has psychosocial and spiritual component as well. This in homeopathy is the right
Yes.
speciality
We
to
take care.
evaluate patient the
Yes.
other aspect of the
Yeah.
patient, right?
We call it
So
as life space investigation, how they're
yeah,
placed in life.
huh.
It's a sort
So
of
you
psychotherapy.
people evaluate them, their psychology, their social
Yes,
background, and also so that is palliative care. Your scope is that now you can confidently you can say that you are doing palliative care, right?
yeah,
Secondly, you can identify or separate those patients in your practice who are of life limiting illness, advanced stage of the disease. You can
okay.
separate those patients. For those patients, you can learn the communication skill which we have put up in our course, like how to do breaking bad
Yes,
news, how to tell a patient that now you are dying, Now your disease is not curable, right? Then to understand their requirement of the end of life care, that time patient has special other symptoms, pain, other psychological issues, all such things to be addressed. Then address their spiritual pain. They will be suffering, that why I am suffering, why I got this disease, why I am dying. Also, this is called spiritual pain. So we the scope of this one this course is to learn in detail about the all aspect of palliative care. You can have hands-on training also in few of the centers we have where full-fledged palliative care is given. Like my center has got a hospice. It has we have got a palliative care OPD, home care services, and all such things. So you can come to this type of center for a week, 2 weeks, and do hands-on training, and you will be able to practice palliative care better.
Okay, that's great. Actually, I wanted to know one more thing is psychological is fine, social is fine in care, but what is the psychosocial? Like exactly
Psychosocial. So it is
some.
basically psychological and social. That combine is psychosocial.
Okay, okay.
Yeah. So social issue is like these patients are, because of social stigma, they are isolated from society. They are not very well accepted in the society, and not sometimes not even in family. Right? So then they have got very much psychological issues like depression, fear, anxiety. What will happen to me when I am dying? What will happen to me? What will happen to my children? And all such worries, fear, all such things are psychological issues.
Yes.
Anything? One more participant is here, Mr. Ambik, Dr. Ambik.
Dr. Ambik, are you online?
Yeah, I am online.
Yeah. Could you turn on your video and ask question to ma'am?
Actually, I was not well. I just got up. Okay, it's okay. Hello.
Yeah, yeah, yeah. Your
Hello.
video is visible, ma'am. Good evening, ma'am.
Yeah, if you cannot speak, you can write your question in chat box.
I am not fluent in writing also. I'll just try to talk whatever
Okay,
I
okay.
can.
Yeah. Hello.
Yeah, ma'am.
Yeah,
Hello.
बोलिए. You are a homeopathy doctor?
Yeah, I am also homeopathy and a friend of Vimla. We both.
Okay. And practicing where?
Yeah, I am practicing in Tumkur, ma'am, near Bangalore.
Guntur. Okay. Yeah, yeah.
Tumkur,
Guntur.
Karnataka, Bangalore, near Bangalore.
Okay. Okay. So you must be treating patients of cancer
Yeah,
or
I recently lost my mom who was bedridden for 2.5 years, and this interested me in taking this palliative care. The nurse who was coming to visit my mom was not so good, I thought. The dressing, whatever he was doing, was not correct. The practical form also we have to learn in this palliative care.
can you repeat your question?
We know we'll know the
Be
theory by
louder.
theory we'll know regarding dressing,
Okay. Okay.
everything. We should know more about that. What I
Yeah,
kind.
so what I was telling you, that you must visit a palliative care center nearby. Like in Bangalore, in Kidwai Hospital, there is a department of palliative care. There is a Baptist, there is one hospice,
Karunashray,
Karunashray, and that
Baptist Christian Hospital.
Baptist, yeah. So you can visit those hospice and such palliative care services, and you will get to know more in detail about how the things are done actually in practice.
Okay.
Yeah.
Ma'am, one.
Yeah,
Shall I,
Vimla.
One more question, ma'am. Ma'am, actually, this in this course, it's been repeatedly told that we would like to have a death at home, sort of means not to be
Yeah.
in the
Online.
ICU.
It is
Yeah.
online.
No, no. Means dying at home is always good, or the patient would prefer that. Actually, that is what is mentioned in the
Yeah,
course.
yeah.
I do agree. I mean, that's a nice thing, but social stigma. I mean, we have a problem that if the patient dies in the hospital, all the procedures like getting a certificate, death certificate, and
Okay.
managing things will be
Yes.
easy. If the person dies at home, nobody is going to certify them and things like that.
Okay.
Yeah.
Okay.
So,
Yeah.
what would be the
Yeah.
how the things will
Yes.
go?
Yes. See,
No,
when you know.
can I just speak?
Yes. Yes.
Actually, if a person is dying at home, now the
Yes.
procedure is that at the time of cremation, they
Okay.
give a slip to you, and you produce that slip to the Nagar Nigam and the municipal corporation, and they issue the death certificate. So it is not very difficult.
The
It is
death
easy.
certificate
And
will be
in any case, that final death certificate has to be issued by municipal corporation and not that of the doctor. On the basis of the death certificate of the doctor, you can get that death certificate from the municipal corporation.
I know. But who
Yeah.
will be the doctor to certify this now? At home
Now,
means
why do you need doctor at the time of every death?
I don't know. That is
In,
what
in,
I have heard.
no, in case
Friends,
of
the
normal death,
parents.
you don't need a doctor to certify the death.
Okay. Oh,
Yeah.
Hello. I'll tell you. I'll still elaborate on this issue.
okay, ma'am.
If a young person is dying, no, they insist for a death certificate from a doctor. Young person means age less than 40 or so. But
Okay.
if he is suffering from a life-limiting illness like cancer or any other illness where you know he is likely to die, so in last few days or few weeks, you can get connected to a general practitioner, MBBS doctor,
Ach.
and
Oh,
inform him that such and such a patient is being cared at home. So
fine.
he is responsible to give you the death certificate.
Okay.
In elderly patient with life limiting illness, even if he dies at home, you take him to cremation. They will give you a cheat.
Okay.
Cremation people will give you a cheat that such and such a person is buried over here or cremated over here.
Ach.
Based on that cheat, a doctor can give you certificate, and then the municipal corporation will give you their certificate.
So,
So when you are treating this patient for a long time, you can get connected with a MBBS doctor.
that's a
He,
nice
he, he may not treat him, but he should know that such a doctor
inform.
patient is being treated at home,
Oh,
likely to die, and he is responsible for giving
ach.
certificate.
This satisfies. Yes, ma'am. Thank you, ma'am. Ma'am, any other centers in this in Gujarat near Kutch and other places, ma'am? Hospice.
In
Hospice
Gujarat?
or any cancer institute, Gujarat, Gandhi Dham,
In Gujarat?
Gandhi Dham.
Huh.
Any cancer institutes or any such?
No, Gandhidham doesn't have any cancer institute or a hospital.
Okay, they have to come to this
Yeah.
Ahmedabad and
No. There are from Gandhidham they can go to Bhavnagar, then Rajkot, Jamnagar, all such places has.
oh. Now I am staying for a brief period here, ma'am, in Gandhidham.
Oh, okay.
Yes. Otherwise, I am Mumbai.
Okay, yeah, from Mumbai. Okay. Okay. So visit us in Ahmedabad whenever you've got opportunity.
Sure, ma'am.
Yes.
Sure. I understand. So, uh, nice, ma'am.
Mr.
Hello, sir. Good evening.
Mr. Murli, can you read the questions so that we can discuss further?
Sure, sir. I'll just read out the questions, sir. So those two questions we received through Google Form, sir. And the one who posted is Pungurli Shanmugam. She's a homeopathic practitioner. In brackets, it is mentioned as BHMS. The question is, dear doctor, As a homeopath, I hope our wide scope in the field of palliative care from the diagnosis to bereavement. Many evidence-based publications available nowadays on the effectiveness of homeopathy on oncology. What are the future plans of Ayush-based integrative palliative care to include Ayush qualified practitioners? That is the first question, sir.
Hmm. So basically, this National Association of Palliative Care for Ayush and Integrative Medicine, as the name suggests, we are promoting integration. What Ayush practitioners have to come up, they have to develop interventions in palliative care. Because again, if you see the question, they are again talking about oncology. So why are we confused? We are not treating the patient in case of palliative care. And it may not only be the cancer patient. There may be other patients who are suffering from terminal illnesses, or maybe, for example, rheumatoid arthritis. Now they have lifelong pain. And so we are treating other patients also who, in fact, have no cure for their suffering. So development of interventions in Ayush, because palliative care is missing not only in Ayush streams, but also in MBBS streams. So people have to come and study palliative care separately. Their normal curriculum is not having it. So first of all, so as a beginner, they have done this 3 months foundation certificate in palliative care. If they want greater knowledge, they can upgrade to the 6 months fellowship or 1 year master course in palliative care. And these courses are available at our website, which Mr. Murli we have already shared in your email. That is napcaim.com. And in case if you are interested to more work and in coordination with any organization, then NAPCAM, NAPCAM is the best organization. You can become a member, and becoming a member or applying for any courses, further courses, you can always, it is a real-time website. You can apply through the website. We'll confirm, and you can join us as a member. You can join us as a student, and certainly we'll encourage you to integrate palliative care. And it is not only a single therapy which is effective in palliative care, but it is a multidiscipline team. And we have allopathic doctors, we have nurses, we have volunteers, and we want to welcome Ayush doctors also to come in and join hands. And because they are present in all nooks and corners of the country. So basically, when we are talking about palliative care, they can give palliative care throughout the country because of their widely presence. Even a remote area, you'll find one of the Ayush doctors over there. So it is a welcome move, and I welcome all of the Ayush people to join hands and get in touch with us, and we'll be ready to help them whenever and wherever it is possible. Geeta, if you have anything.
Yeah, basically we want Ayush doctor to know that they are practicing palliative care and come up with the evidence of their stream uh, about various practices in palliative care. Secondly, if they join our organization, they become a member, they can do number of courses at concessional rate. Third point, we are regularly holding, organizing various small or workshops, conferences throughout the year, throughout various chapters of the NAPCM. They can participate in that, they can make their presentation, and they can share their experience and views on the subject of palliative care. These are the basic aims of our NAPCAM. Right?
Yeah, thank you so much, ma'am. Thank you so much, sir, for the answer. And now the second question by the same person is, as living in the textile hub of Tamil Nadu state, Erode district, here I observe many cancer patients, yet they majorly depend on private medical institutions for the quality of care. Even needs to go to Kerala for the affordable care. What will be the measure to improve the quality of care?
When we are talking about palliative care, that is the reason that palliative care is mostly confined within the state of Kerala. And why we have launched these online courses, that we want people all across the country to learn palliative care, rather than earlier what was happening was they spent maybe thousands of rupees to go to Kerala, stay over there and do a 6 weeks course or whatever different types of courses are there, which was very cost expensive. So we have come, even MPTL has taken out this course, which is free of cost. So you can know palliative care, you can learn palliative care, and you can practice palliative care across the country in any place wherever you are. So you can become a caregiver right now, but you need practical also. So for practical aspects, you will have to go to a maybe palliative care center and you have to gain palliative care experience. And in that, even we can help you, which is the nearby center. Geeta ji is there to help you out. So getting practical experience, theory we have already taught you. Practical experience, you need to visit any institution and learn from there. So that is something which is important. Geeta ji, if you want to add anything.
Palliative care itself is a very affordable care. Any person who is suffering from life-limiting illness and goes is given only palliative care, it is very affordable. It is not very costly affair. So your practices should convince the patient. Your communication or any counseling methods should convince the patient to accept the disease and to give consent for you giving palliative care. So there is no question of going to Kerala for palliative care. In each and every state, there are small or large centers of palliative care across country. And now we want even Ayush doctor to practice palliative care. So at least they should be able to give these services to the people who are residing their own areas.
Thank you so much, ma'am, for the answer. Now, the other question is from Dr. Jayashree. She works as a faculty. I'm working as an assistant professor, Ayush faculty. How this palliative care will be helping me in my career? Planning to take the advanced course in palliative care. That's the question, ma'am.
Yeah. See, the any Ayush doctor like in our allopathy field, any person who has taken special training in palliative care is recognized as a palliative care physician. Similarly, Ayush doctor who has taken focus his career in palliative care can also do wonders, you know. And being a faculty in a homeopathy college or Ayush college, you can become a specialized palliative care faculty and teach your student about the palliative care. So there is a very, very wider scope of palliative care, even in Ayush stream, even the academic side of the Ayush stream. So they can, it is very much welcome if does advanced courses in palliative care to enhance her knowledge and her exposure and get a even hands-on training will help her a lot.
Thank you so much, ma'am, for the answer. That's all we received, ma'am, from through the Google form. Now, whoever is active, we will ask, ma'am. Vimla, ma'am, do you have any other question? Ambik, ma'am. Just wanted to know whether have you registered for the examination, ma'am?
Yes.
Yes.
Okay. Geeta, ma'am, could you give some tips for last minute preparation?
Yes, ma'am.
Okay.
Too many,
Yeah.
too much.
I'll give a message to all our NPTL students
Yes.
that it is a very, very simplified course which we have put up in your to you, and do attempt all the assignments, very simple MCQs, like, you know, and do prepare well for the annual exam also. This will definitely encourage you to study further about the palliative care and give you confidence of practicing palliative care in whatever stream you are, whatever stream you are. Even we have included complementary therapy in our palliative care practices, like yoga, pranic healing, and which other
Music therapy, art therapy,
art
ecotherapy.
therapy, music therapy, and also thing. All these thing has got some role to play in palliative care as a complementary therapy. So whichever stream you are, Do this course sincerely and study well.
And one thing maybe in the final exams, it will be the clinical aspects which may be more important.
Final exam?
Clinical aspects would be more important.
Yeah. Anything else, Murli?
As of now, that's all those are all the questions, ma'am. Um, so let's see. Vimla ma'am, do you have any other question?
No,
Ambik
sir.
ma'am?
Have to study, that's all. Do the last assignment. That is
Sure,
there.
ma'am. Sure.
The
Okay.
assignment is
Do
pending.
that. So, but nice questions, ma'am, and like a thorough like study is needed to answer those assignments. That is done nicely, and
Okay.
all the faculty are doing their good job. Sometimes we revise while doing some work and other things, listening to the interviews and things like that. Everything is helping, ma'am.
Mm. Thank
What
you,
I
Vimla.
felt
Thank you.
regarding the
Thank you.
course,
Thank you,
Thank
sir.
you, and
Ma'am.
welcome to the
topics are
maybe
little
professionals of
confusing, I
palliative.
think so.
Okay, sir.
Ah, someone is speaking from background. Yeah. Can you please share?
Yeah.
Yeah, somewhat regarding the course, I felt that little confusion.
Yes. What
Topics,
sort of confusion?
topics are so confusing, and we needed more time to revise, I felt.
Yeah, I can understand because it is a new stream altogether.
Yeah,
But you'll understand that 50% of that is very much which should all be known even by housewives, not medical students.
but
So it is a very general course. I can understand because you are hearing new terms, new terminologies are there, so it will become confusing. But once it is the practice which is more important. I think you are getting the essence. Remembering the technicalities is not that important, but understanding that what is palliative care, because we are doing palliative care at our homes itself. There may be many times you become a caregiver rather than a doctor, even in your home. So that has to be that all that essence is more important. What message we are giving, technicalities, of course, you can revise whenever you need it. But understanding palliative care, not again, because many a times we hide from the patient about the disease. We don't discuss the treatment protocols and anything, especially the cost of treatment, etc. And it is forced on the patient. Then dying at hospital, uh, good death, what is good death, all these are very general things, and but still we don't practice. And many times a dying patient is especially when you are talking about those dying with cancer or terminal illnesses, we still take them to ICU to die in the ICU and on ventilator, which is unethical. But making understand their caregivers, their family members, and even the doctors don't understand at the wrong moment, they'll refer such patients to ICU. So all that has to be integrated within the society. So all of us, we should, and it is really very, very disgusting for the patient. In his last time, he cannot meet the family members, he cannot express his words, and it is a cruel death, what I'll say, when a terminal patient is dying on ventilator or in ICU. Geetaji, if you can add.
Yeah. See the general trend in our societies, because people do not have knowledge about palliative care. They are not aware about the palliative care. They are not taught to accept the death. Uh, that is the basic problem. So being a palliative care physician, you make them understand about the closing of life, death, and accepting the death. So what happens in society, since they are not aware about palliative care and death, any even from the poor family, they will call 108 and take the patient to ICU, right? And sometimes to the private clinic also. So during last few days, they spend hell of a money. At what cost? Patient is isolated. He cannot be among the family members, and he will be dying behind the curtains. So this awareness needs to be done. This will not only reduce the hospital cost, but patient will die at peace among the loved ones with good care at home. So that is also one of the aim of palliative care, that patient should die, as we always talk about quality of life, good life, we should talk about good death. And the good death is one where patient doesn't have pain, his symptoms are relieved, he is dying among the loved ones with the care of loved ones at home. That is what the aim of palliative care is.
Thank you, ma'am, for the answer. Thank you, sir.
Okay,
So
ma'am.
anything else, madam? Ambik ma'am, Vimla ma'am?
Yes,
So
sir.
one thing again I would like to share, rather than being only palliative care professional. Now, if you are into palliative care, you will have to become an advocate. You have to teach your fellow people also, and that is very important because many a times you will have to do advocacy. So learning advocacy again is very important. Not only learning but practicing advocacy in palliative care.
Don't hesitate to say that I am practicing palliative care. Many people hesitate. No, palliative care means it is given up. Now nobody can cure this patient. That's why you are involved and all such things. Forget about it. What you are doing, you must advocate. The palliative care is not a taboo or not something to be fear about or shameful about. Start telling people that you are doing palliative care. That is most important, and you can
And many
advocate others.
and many times people are confused with euthanasia in palliative care. So now, since you have already studied, so you have to clarify the doubts of the people.
Yes. It's a voluntary one. Euthanasia.
Okay, Vimla, nice talking to you.
Okay, ma'am. Thank you so much. So we'll try to do our best in the exams.
Okay.
Okay. Thank you for all the support.
All the best for the exams.
Thank you, sir.
All the best. Yeah.
Thank you, ma'am.
Yeah.
Thank you.
So I also take this opportunity to thank Dr. Piyush Gupta sir and Dr. Geeta Joshi ma'am to offer such a wonderful course. Um,
Yeah.
so that's all.
Thank you, Murli, for arranging all this. Thanks.
Sure, ma'am. Sure, ma'am. So can we wind up the session, ma'am?
Oh,
Yeah.
yeah.
So we will close now. Thank you so much, participants. Uh,
All the best for the exams.
Thank
All
you.
the best. Yeah.
Thank you, sir.
Bye.
Thank you, everyone. Thank you.
Thank you.